Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. You please subscribe for our YouTube channel, like, share, and subscribe for this video. And you can follow us on other social media platforms, the links for which is given in the description box below. And today, in conversation with me on the Two Talk, I have Dr. Pooja Gupta. To give you a brief introduction about Pooja, Dr. Pooja Gupta has done her post-graduation in dietetics and applied nutrition from the prestigious Nirmala Niketan College affiliated to the University of Mumbai in the year 2001. She has a vast experience in clinical practice for almost 19 years. She has established herself as a senior dietitian in PD Hinduja Hospital, Mumbai. She was the chief dietitian in the Kokilaben Dhuribai Ambani Hospital, Mumbai. She has to her credit various news articles and has also featured in the All India Radio. She has attended various continuing education programs related to dietetics. She is also seed rotation therapy practitioner, which exclusively takes care of PCOS patients. Currently, she is attached to the Physicure Bhopal, where she prescribes specialized diets to medically compromised patients. She is also attached to Shamrock Honey Kids Bhopal. She is a consultant dietitian on the panel of IKEA Foundation and Bionutrients Bhopal. Currently, she consults people across the world through her website, My NutriBites. Hello, Pooja, and a warm welcome to you on this To Talk with Your Dentist conversation.
Hi, Dr. Rekha. Thank you so much for a warm welcome from your side. And it's my pleasure to be on your channel today and speak a little about nutrition and dental.
Sure. Thank you so much for that. When we say diet, nutrition, and dental health, I think they kind of go hand in hand because they're so closely related, right? I mean, whatever food we
Right.
eat has to happen through the mouth itself, and unless our oral health is not good, it really becomes difficult to assimilate all the nutrients that would be required for our daily activities. So,
Right.
Dr. Pooja, since you are into clinical practice and you also counsel people who are medically compromised, debilitated patients, basically. So, I just thought, if we can have a conversation today and you can share your knowledge and information with our patients, especially in patients who have undergone a surgery and a surgery, especially in the jaw area, in the specifically in the face and the head and neck area. So, what is the kind of food, the kind of diet that you would prescribe for such patients?
First of all, I would like to tell you about the role of nutrition in total. Nutrition, not only in dental surgery, but in any kind of medical illness or any surgery which a person undergoes, nutrition plays a very vital role. May it be pre-surgery, may it be post-surgery. So today, as we are looking on to the dental topic, the nutrition is a very multi-directional. It has a very multi-directional impact on dental problems. So I would focus on the real nutrients that are required during surgery and after surgery. Pre-surgery, it's not so important, but post-surgery, yes, the nutritional requirements vary from person to person. So, diet, nutrition, and dental health are closely related and have multi-directional impacts. Nutrition plays a major role in the post-operative recovery and healing, and each nutrient has a specific role to play. May it be carbohydrates, proteins, minerals, vitamins. And what I have seen in many cases, like not only dental otherwise, but specifically in dental, the jaw bones are very important to be back in place after any surgery. So the
Yes.
healing is important, and maintaining the integrity of the oral tissues is also equally important. So, patients undergoing surgical procedures require more of protein sources to give them required cellular proliferation and also repair and energy.
Yes.
So, also
Yes.
protein plays a vital role in fracture repair and bone healing. So, after surgery, the consistency of diet will vary from the liquid to solid to semi soft, all those ways. So, in each and every type of diet, the main role is of proteins. So you have to make sure that adequate amount of protein goes into each and every feed that is given to the patient. Like I would also at the end give some examples of which types of foods can be given
Yes,
and how
yes,
you can incorporate protein sources, because not all food items are rich in protein. So you need to fortify them using certain protein supplements or some natural protein rich foods like dals and pulses. You have to give them smoothies, milkshakes, some ice creams. So all these require in itself they have protein, but along with that they need some supplementation too. So that is the way it goes.
okay, okay. So also what happens is, I think during a post surgery, since again patients will not have the ability to have their normal food, and they have to rely on, like you said, on supplements, and they have to alter their diet. Possibly what happens is, their gut, that is their stomach, probably has to begin to accommodate the change in the food that has to happen. So, what kind of food that would especially be required to maintain the health of the gut, so that all the absorption and assimilation happens properly?
Yeah, you are very much right that the GI plays a very important role after any surgery because your digestion matters a lot. The body requires nutrients, the mainly the proteins, carbohydrates, and energy-giving foods. But not every food is digestible post-surgery because the patient is in a compromised state. So that needs to be taken care of. You have to select the foods very wisely so that the person doesn't fall into another problem after major dental surgery, because the dental pain what a patient
Yes,
undergoes is not a easy pain to undergo.
yes,
So it's very important that you take care of the patient from both points of view. Give such foods which are very light, very easy to digest, and which are probiotics mainly.
yes,
Okay, probiotics means the foods that come under that category are curd, milk and milk products, then fruits, fruit juices. These food items are easily digestible and they won't harm the patient even though they are not able to chew them or not able
yes,
to gulp them easily. So it's very important that the consistency and the type of food given to the patient, how it is absorbed and digested by the patient's body.
okay, okay. So I think some set of instructions, the doctors themselves would have given. But I think one round of consultation with the dietitian, I think it really helps them to actually understand, even region wise, the kind of foods that are available. Because I think across
Yeah,
India, you have so many varieties of foods that are available. So I think
right.
region wise also, your dietitian will be able to advise and tell you, specifically what food they have to have.
Yes, yes. That's what when we consult the patient one to one, we take into consideration all these factors like from where do you belong and what are your daily eating habits, so that I don't include any foreign food products which they will totally be not able to accept.
Yes,
So that's very
yes,
important, and accordingly we plan and see the condition. Majorly, not all all jaw surgeries or all extractions are the same for every patient. It's
yes,
like one size doesn't fit all.
yes, yes.
So that's
True,
the same
true.
case applied in dental surgeries too.
Correct, correct, correct. So I think the diet has to be customized to each patient according to their requirements and according to their ability to take in certain foods. So
Yeah.
so when we talk about the foods that are allowed and the patients should take, Pooja, how would you say, what are the kind of foods that patients should avoid during such times? So because sometimes I think they are not aware, they probably assume that okay, it is okay to take certain foods. So during such times, what is the food that they should avoid?
Uh, what I have heard, and when I have practiced along with the expert dentists, I have always heard from them saying to the patient, you have to have no chew diet, like wherein chewing is not involved at all. So
Yes,
when we have to plan a diet for such patients, we have to keep in mind certain things, that yes, the patient should really be able to easily gulp it down so that he gets the required energy. So I
yes,
have a small list of things which patients should keep in mind when they have to choose and select that okay, this I have to avoid from my diet when
yes,
I have
yes,
undergone a jaw surgery. So the
Yes.
examples are they have to avoid hard-boiled eggs, fried chicken, fried other fried hard foods. Then any crunchy foods like chickpeas and crunchy peanut butter. Then dry cereals to be avoided. Like they cannot eat
Yes.
cornflakes just like that. It's better to soak them in the milk and
Milk.
then have it or blenderize it. Even though they can
Yes.
chew it, soft food is not easily chewable at times,
Yes.
so it's
Yes.
better to make it in a puree and then have it. Then they should avoid cereals with dry fruits and nuts like muesli. Okay.
Yes.
They should not have hard toast, breads, and muffins, donuts, because they become tend to be sticky, and
Yes.
it may get stuck up in the tooth later. Then
Yes.
you have to avoid sweet or savory crackers and biscuits like cream biscuits and all.
Yes.
They have to avoid raw vegetables. It's always better to have pureed boiled
Puris.
vegetables.
Yes.
Yeah,
Yes.
in the form of broths or soups. Then mainly salads. People who are fond of eating salads for weight loss and all, they have to make sure they avoid lettuce-based salads, because lettuce has very fibrous texture that may tend to get stuck in the teeth again. They have to avoid very fibrous vegetables. If you're fond of eating carrots and cucumbers raw, don't have it like that. You either boil the
Yes.
carrot and then have it. Then also fruits with the skins to be avoided. You have to peel the skin and then you have to have. Also fibrous fruits like oranges and pineapples, because orange peels and all, they tend to get stuck in your teeth. And chewing gums and sticky candies to be avoided.
Yes.
So this
Yes.
is the list when we give to the patient, they can take away home.
Yes, yes. I think that was very useful information, Pooja. Especially, sometimes I think patients kind of they would possibly miss some things, the instructions that would have given, or they probably would get a doubt. So I think in such cases, it is best to have an appointment with a dietitian, and fix up for the next. Suppose if it's a simple surgery, probably for the next 3 4 days, or if it's a little more complex surgery and they need some follow up, say over a period of 10 or 15 days. I think it's best that they meet up with the dietitian, prepare a list of the do's and don'ts, and probably stick it up somewhere, where they can, have a look at it every day, like a
Yeah.
reminder that, okay, you can have this, you cannot have that,
Um,
right?
yeah, yeah, very true, very true.
Yes. So, anything else, Pooja, you would want to tell our patients, especially, since you deal with medically compromised patients, on a clinical level,
Yeah.
and you prescribe diets for them. So, probably this is also a bit of a compromised phase itself, when a patient can't actually eat his normal food. So, from your experience, is there anything else that you would like to tell?
Yes, I would like to say that, especially nowadays during the COVID times, people have understood a lot. Like looking at the condition around, people themselves have become aware and are becoming aware of the healthy food, immunity, and all those terms. So I would always advise people to eat healthy and fresh, and don't think of dieting always. Like people always keep
Yes.
in mind dieting,
Yes.
like we should always eat every food item in proper proportion so that it doesn't harm our body. We
Correct.
will be getting all the required nutrients at the same time. We will be away from various diseases, and if we are having any disease condition, we have doctors, we have experts, we have dietitians whom they can approach. And I would say the same for my case. In case of any medical related diets, people can contact me easily. I am always available online, and people can visit my website too.
That's
Thank
great.
you.
That's great. So I gather, Dr. Pooja, you will be available on your website, My Nutri Bites.
Yeah,
So
right.
people can log on there and connect with you on that. So
Sure.
thank you so much for joining me today in today's talk, and sharing your expertise and experience with our patients, especially when it comes to post-surgical diet plan.
Thank you so much, Dr. Rekha. It was my privilege to be with you and share this platform with you. Thank you
Thank you.
so much.
Thank you so much, Pooja. I hope I can team up with you again, to do another interesting topic, that I can share with our
Yes,
patients in the future.
very, very much, very much. I would
Sure.
be happy to do that.
Sure. Sure. Thank you so much.
Thank you.
Bye.
Bye.
So viewers, that was our diet expert Pooja Gupta, who did share with us her knowledge and expertise on post-operative diet care. So if you have any doubts or queries, please don't hesitate to write to us. And if you'd like to get in touch with Pooja, her contact details are given in the description box below. And I hope that talk was helpful. If you did find it interesting, please do like, share, and subscribe to our YouTube channel. And until next time that I come back with another expert who will share their expertise and knowledge with you on your oral and dental health, keep smiling, stay safe, and be happy. Thank you so much.